Private practice radiology can be an extremely unstable endeavor. People may not realize this, or maybe people already knew this, but a physician, you can actually be in a very unstable situation as a physician in terms of your employment, especially if you're in private practice. I saw this firsthand when I was in LA, and it's one of the reasons I left LA is that I spent a lot of time in private practice wondering about my next paycheck, and I felt like I really didn't want to or have to do that. And what I saw was that in private practice, you spend a lot of time doing this. Now, if you don't believe me, talk to some physicians in private practice right now, especially during this coronavirus pandemic. And you'll see that a lot of them are probably worried about what's going on with their next few paychecks. And the reason is that in private practice, your contract is really not between you and a hospital system. Your contract is really, the value of your contract is based on the value of the collections from your professional billing. And if your patient volumes are down, or if your collections are down for any other reason, which could include non-payment of bills, a bad insurance market, a bad local health insurance market, the value of the collections of your billing could be pretty low. And if the value is low, then the value of your contract is really nothing. And your paycheck could be a lot less than you expected. And if you've already kind of built up your lifestyle with an expectation of a certain paycheck, then you're going to have a tough time in private practice, because in private practice, nothing is guaranteed. And that's kind of the lesson learned of private practice. So private practice can be a very unstable thing. Private practice is a different relationship. You sign a contract with a group, and the group works for a hospital. The group has a contract with a hospital. You might think it's sort of like working for the hospital, but it's really not. You've signed a contract with a group to work for them, and the group has signed a contract that you'll probably never see, or maybe you'll see you as a partner. The group has signed a contract with the hospital to provide professional services for that hospital. The value of the contract is literally just the value of the billing, the professional billing. You may not know it, but the group may not really have much assets. And it's sort of like when you're evaluating a person. It's sort of like how you get evaluated if you were to apply for a home loan. How much assets do you have, and what are your cash flows for the last 2 months? You may find that in a practice that their assets are nil, and then the cash flows are really not that high, because they might have maybe a lot of income from professional billing, but they might have a lot of outflow too from debts, or just other things you really don't understand or know about. So just realize that, what are you really getting with your contract? You're getting is that you're seeing what the group sees, which is they have a contract with the hospital that they have to fulfill, and that contract can unfortunately be canceled at any time with 90 days notice. Why would that hospital contract be canceled? It could be because they're not fulfilling the needs of that hospital contract. All it really takes is for one or two partners to leave a group, depending on the size of the group. But if it's like a 10-person group, really just one or two partners can leave the group. And now all of a sudden, the ability of that group to provide professional services to that hospital in a reasonable manner is extremely difficult. Therefore, the contract's at risk. Therefore, your employment is at risk. And the situation can occur very easily. It actually occurs a lot more often than you think. All it really takes is one or two people in the group to feel that their needs are not being met by the group. And once they decide to leave, then, like I said, your employment is at risk because the hospital contract's at risk. I think you need to go into private practice with the right set of expectations. You have to know what you're getting into, and you have to realize where you are in life, what you're trying to get out of it. I do think that larger is probably better. A large private practice, there's more room, there's more wiggle room. Small private practice, there's not so much wiggle room. You have to learn to evaluate the practice where it is geographically. What's the value of that contract? When that contract is for professional billing, what's the value of professionally billing for services in that insurance market? If that insurance market is dominated by a lot of low-income people with poor payers, poor payer mix, then the value of that contract is low. Contrast that with if you're looking at a group in an affluent area, then their health insurance there is generally pretty good and pays pretty well, and therefore your contract value a little bit better, a little bit higher. And in fact, the likelihood that there's an opening in that group is much lower too, because if the area is nice and the insurance contracts are nice, and the group is in an affluent area and it's a desirable area, then the chance that the group has an opening is also less, because if you're a partner in that group making a solid amount of income with good time off, then why would you ever leave, right? And that's kind of how understanding all this market works, this market for private practice employment. So that's kind of what I want to touch on in this video, is that private practice, again, nothing wrong with it, but it is unstable. It can be unstable, and it really starts with the opening, with your entry into that group. You got to think about how you got introduced to that group, why there was an opening in that group, and you got to understand that the reason for the opening in the group means that there was some instability, and you've got to understand that instability could continue after you join the group, and that instability is related to how internally that group is communicating and working, and really the value of the group's contract with the hospital and the value of the insurance market in which your group is operating. All right. That's all I got for this one. Sarel Gaur.